Hello, everyone. This is Patrick Helton, and this is my Healthcare Leader Evaluation PowerPoint presentation. Thank you for listening, and I hope you enjoy. Hello, everyone. For the first two, or for choosing two Health Leader Assessment Evaluation models, after reading the chapter, I decided to reach out to my boss to see what the healthcare organization that I work for uses um, in our company to assess and evaluate this. I thought this was a good idea since we are close to graduation, and also I wanted to learn more about how my company um, assesses and evaluates leaders within the healthcare system. So the first model was that I picked was the Kirkpatrick model. It is used primarily in evaluating training programs and leadership programs, and there's four levels to it. The reaction of the employees or the leaders, the learning, how well they learned and understood everything that was given to them, the behavior, how do they take what they learned and use it into their day-to-day lives or day-to-day work lives, and what are the results from these training and leadership programs. Some of the strengths are there is a solid core link between training and the organizational outcomes. I know every year we get six training modules that we have to do, and all six of those modules usually correlate with our organizational outcomes. Some are for the quarter, some are for the year, but they always link back to what the organization wants out of us as employees and what we want to give to the community. Another strength it was that the Kirkpatrick model encourages continuous improvements within the training program. So there's always going to be um, they want that there's always going to be employees or leaders to ask, well, what's more? What can I do more? And that drives the continuous improvement models. Some of the weaknesses are it can be very time and resource consuming. I know that some of these modules can take up to a couple hours for us to do. And if you sign up for certain modules, you might be gone from the department from working your day-to-day tasks for the full day, maybe a day and a half. So you are pulling employees and managers away from their day-to-day activities. So that costs you time and obviously costs you resources. And another weakness that I thought was really important to address is it requires long-term training and tracking to see the results. This isn't something that they finish the module or they finish the training program and they instantly see results. They have to track these results over time, so it does take a significant amount of time to see this. The second model I chose was the Healthcare Leadership Alliance model. It is also abbreviated HLA model. But the overview of the Healthcare Leadership Alliance model is it defines competencies which are required for effective leadership. Um, it defines what my healthcare organization expects and what is needed out of a leader day to day, every day that you clock in. That's what they expect out of their leaders. There's five components of it: communication and relationship. I feel like that is kind of talking about the communication relationship of for the leader for those to the employees that work under them. Their leadership, how do they handle themselves as a leader? Professionalism, also how do they handle themselves as a boss coming into work? Can they separate being a boss from having employees, or does the boss kind of be more of like a friend rather than a boss? And knowledge of the healthcare environment. Healthcare is always changing, so you had to have a vast knowledge. You always had to be quick on your feet when new information comes, and that actually implies to one of the weaknesses of this program, which I'll get into in a bit, and their business skill knowledge. So some of the strengths are the one I listed is provides a clear criteria when evaluating performance and development. So it's pretty clear cut when it comes to evaluating, and it provides the information of why it's clear cut and what they are clear cut on. Some other ones I have written down are it focuses on certain aspects for healthcare leadership. It's organization specific. So it is focusing on what the organization wants. Um, and that kind of relates back to the Kirkpatrick model of the link between the training and the organizational outcomes. They both have specific needs of what they want from their leaders. Another strength is support specific targeted training and professional development. So it will allow a direct link between what is supported by the target of this training and the professional development and outcome it wants. Some of the weaknesses are, as we know, the healthcare system, as I stated, is always changing day to day. There's always new information coming out. So this model does require frequent updates. It's not something like the Kirkpatrick model that you kind of get modules for and they're set with due dates. This is something that will have to be updated frequently. Another one, just like the Kirkpatrick model, is very time and resource consuming. Training is not something that could be done in 30 minutes. I believe if you train within 30 minutes, you're not going to really get the outcomes you want. It's going to take time, and people have to understand that it will pull employees or managers away from their position for maybe a day or two or half a day, but it's worth it in the end. And there's a balancing. Another weakness is there's a balancing the evaluation of numerous competencies can be very difficult. So when it comes to evaluating these competencies, and there's numerous of them, it can be difficult to evaluate each and every one of them and get a good evaluation from that. So this is the Healthcare Leadership Alliance module, and I'll be on my next slide. For this slide, I'll be talking about the Kirkpatrick model's metrics. So all these are based on the 4 levels that I talked about on the Kirkpatrick slide, which are reaction, learning, behavior, and results. So the metrics for the Kirkpatrick model are participant satisfaction and engagement within the training. So that's the reaction part of it. Pre-assessment and post-assessment assignments are given to help measure results. So maybe before you start the evaluation or the training, there is a pre-assessment on what you know on the information, and then also post-assessment on what you learned. That way they can judge the learning aspect of it. Observation, feedback from your coworkers and your management, the behavior, so how you took that information and applied it in your day-to-day work life. And the results portion of the Kirkpatrick metrics would be organizational performance measurements, such as the patient outcomes if you're on the patient care side, the financial performance if you're on the financial side and don't deal with the patients on day to day or ever, and the developmental growth as the healthcare organization overall. So those are the metrics for the Kirkpatrick model. For the metrics for the Healthcare Leadership Alliance model, this is also the model that I seem as most appropriate, and I will explain why after I go through these metrics. So again, the metrics for the Healthcare Leadership Alliance were communication and relationship management, leadership, professionalism, knowledge of healthcare environment, and business skill and knowledge. So these are the metrics for those 5 components. For communication and relationship management, it was the ability to communicate, to build relationships, to manage conflicts between coworkers. So how well does the employee or manager deal with working with others? Can they have a successful, are they good at building relationships and reaching out to people and having good communication, or is it more difficult for them? For leadership, it's more of a strategic thinking of, your strategic thinking, the vision, and the ability to encourage others to perform at their best. For professionalism, the metric is ethical behavior, self-awareness, professional and personal growth. For the knowledge of the healthcare environment metric, it is understanding of new healthcare systems, regulations, and the new trends within the healthcare system. And for the business skills and knowledge, it is financial management, dealing with human resources and development, human resource development, I'm sorry, and operational success. And this is the Healthcare Leadership Alliance module or model is the one that I believe is most appropriate. I think the Kirkpatrick model is very good, but from what I've seen within our healthcare system, and I did choose these from my personal healthcare system, the Cleveland Clinic, I feel like the Healthcare Leadership Alliance model really ties together more of what I do on my day-to-day basis. It's the metrics are more of my day-to-day that I see consistently, and that's why I believe it works better. Communication and relationship is very big. We're always communicating and talking to other departments when we see errors, and we could see that this department was the last one to code it. We reach out to them. Leadership is really important because for all the reasons, strategic thinking, vision, and ability to encourage others, um, our job is we have to get everything out, all these claims out to health insurance companies so that we can get the hospital paid. So having a strong leader that can help through the times where the numbers are super high or is great, and when the numbers are super low, you know, you finished your work, let's go learn something new is great. Professionalism, that could be hard, especially, working from home. I think the professionalism for the Healthcare Leadership Alliance module is more beneficial to us, kind of reminding you to always stay professional, even though we're not in a office space. And understanding the new healthcare trends and systems, that's really big for us. There's always new laws and regulations coming out. There's always new Medicare guidelines, health insurance guidelines. So we always have to be on our feet, ready to understand and learn more. And financial, for the business and skill knowledge, I think financial management and operational success, we don't really do, or I don't really do much with human resource. My boss would probably deal with them more. But the financial management and operational success of the organization is what I kind of deal with, of billing, getting financial statements out, and helping the operation succeed. So I believe that the Healthcare Leadership Alliance model is better in my opinion because it relates more to my day-to-day life, and I could see how all these metrics are used each and every day or every week or every quarter when it comes to my job compared to the Kirkpatrick model, which I think is a good model. It just doesn't really apply to much that I do. And this was my PowerPoint presentation. I would like to thank everyone for listening. I hope you have a great day. And on the next slide will be my references for this project. Thank you all very much.